Hi, my name is Yannick Densis. I am a family nurse practitioner, and I'm here to talk to you about high blood pressure in that video. Again, I want to greet everyone who has decided to listen to that video, and I'm using the poster about your blood pressure. So in that poster, we have uh, important information, and I will read it along. Again, this video is focusing on health promotion and disease prevention. So everything I'm going to say is it's plenty teaching. It's just to it's just to educate. It's not to treat or to give advice. It's just just teaching. And also, I would like to um, to start with God's word, with prayer about disease and sickness. So I'm going to read a passage from Prayers on Fire. This is a little book that I love. I read every day. You have Psalms and prayers. And in page 253, uh, quote, I quote, "Sickness and disease must bow to your mighty power. The stripes all Calvary sealed the deal. Health and healing are mine, body, soul, and spirit. Flood every organ and cells, even the blood that flows through my veins, with your heavenly glory. Strength, uh, Strengthen my bones, muscles, and ligaments so I can finish this race in victory." End of quote. So, even though for God, the sickness and disease, it's very close to God. God wants to heal us, and that's why you have the providers who is here, who can guide you. When you have something, who can help you. But we need also um, people to, to follow the recommendation. And also, the main reason I decided to do those health uh, video is to really help people to take charge about with their health. Having said that, so let's tackle the poster about your blood pressure. So what is high blood pressure? I can, being a registered nurse for since 1989 and a nurse practitioner since 2001, and I'm still working as nurse practitioner. I'm still treating chronic diseases such as high blood pressure, diabetes. I'm treating hyperlipidemia, um, infection. So I can say that high blood pressure is really epidemic disease. We call it, in medical word, we call it this silent killer. We can have it. We can have high blood pressure. We don't even know it. So let's get some data about high blood pressure. In the United States, at least 50 million people have high blood pressure. So they have, they have hypertension. So 50 million, so that's a lot. So that's why it's really an epidemic disease. Hypertension is usually described as being a systolic pressure, the systolic meaning the top one. greater than 139 and a diastolic pressure greater than 89 or both. So when we said systolic pressure, we refer to the top part, and the diastolic is to the bottom part. So systolic is when your heart is working, and the diastolic is when your heart is at rest. The World Health Organization defines high blood pressure as being consistently above 160 milliliter, yeah, 160 systolic and 95 diastolic. And also in the UK, they said high blood pressure is extremely common, affecting 10 to 20% of the adult populations. High blood pressure is more frequent and more severe in African Americans than in the white US population. That's why they said, but working with mostly white populations, white population does have high blood pressure. If I have 10 patients, I can bet you 7 of them have high blood pressure. That's for sure. And in both races, which is African American or white, in the southeastern United States than in the rest of the nation. Although it is uncommon, but not unheard in children and adolescents. So children and adolescents has less high blood pressure, which understandable because this is an arteries disease. So the younger you are, it's more your arteries, they are smoother. So that's why the disease you don't have it yet. In young adulthood and early middle age, high blood pressure occurs more frequently in men than in women. Thereafter, the reverse is true. Hypertension occurs worldwide and is most prevalent in Japan and northern China. In society, they said in societies that consume little or no salt, the incidence of hypertension is extremely low. So in another word, if you consume less salt, you're going to have a less high blood pressure, which makes sense, right? Okay. So now, what is the symptom of high blood pressure? Mild hypertension has mostly no symptoms. If you have a mild high blood pressure, most likely you're not going to have symptoms. Therefore, when your blood pressure is when you have a severe high blood pressure, that's when the symptoms you are going to feel it. That's when you're going to have headaches, shortness of breath, visual disturbances, and giddiness. So this is the symptom for high blood pressure. But sometimes people can have high blood pressure for years. They don't even know it. It's when they go to their doctors or their nurse practitioner or the PA, for routine exam, and they discover that. And also, we cannot have, in order to diagnose with high blood pressure, it's not only one reading. He has to be like different, separate reading. Most of the time, we'll like 3 different ones before we conclude, okay, you do have high blood pressure. So the conventional treatments for high blood pressure It's, the drugs regimens like your furosemide, your Lasix, your lisinopril, your metoprolol. So if you are on those medication, carvedilol, labetalol, the clonidine, all those medication there is to treat your high blood pressure. And traditional home or folk remedies is, they advise you to take fresh garlic, cotton berries, cranberry bark, lime flowers, and yarrow. That's your. So if you want to know more about it, go to a health food store. They can guide you. But there's cautious, okay? The cautious is you have to be cautious. Routine blood pressure check could be taken by everyone. Sometimes, if you go to pharmacy or Publix, we have that automatic blood pressure machine. Anybody can check your blood pressure. High blood pressure can cause severe damage to your heart, to your kidneys, to your eyes. So you should not ignore when you have high blood pressure. When you have high blood pressure, you need to take your blood pressure routinely. The best is to take your blood pressure before you take your medicines. Because if your blood pressure is too low, how would you know not to take it? So if your blood pressure is too low, if you don't know it, you are going to take your medication and your blood pressure is going to go further low, and then you can pass out, fainting, everything. So that's why it's best practice to take your blood pressure measurement before you take your blood pressure pills to prevent, bad side effect. And also, it's advisable also do not take your herbal remedies while taking conventional medication, such as mentioned above, without consulting your primary care provider. And again, your primary care provider can be your MD, your DO, your advanced practice registered nurse. Before, they used to call them nurse practitioner. Now they changed their name for advanced practice registered nurse, and your physician assistant. So high blood pressure can cause, okay, if you have a high blood pressure, so high blood pressure can cause a stroke, okay? The stroke is when it's caused by a break in your blood vessels and bleeding in your brain. If the blood clots block a narrowed artery, it can also cause a stroke. So if you have a high blood pressure, if it's not treated, so that can cause a stroke. So you have to remember that. And also high blood pressure leads to impaired vision and blindness. If it's not treated, that can cause that. And also your high blood pressure can lead to CHF, which is congestive heart failure. So that's why it's primordial to treat your blood pressure. When you have your high blood pressure, it's good you take your medication. The herbal medicine is good, but you cannot. I heard patients who really, they don't want to take their high blood pressure medication, but they want to take herbal. No, contact your physician, but you need to take, once you have a high blood pressure, you need to take your medication. This is a must, because it's to prevent complication like stroke and you become paralyzed. And high blood pressure also can lead to hardened arteries. And also high blood pressure can cause the kidneys to fail. So when your kidneys fail, the next step, they are going to try to hydrate your kidney. If it doesn't work, if it's become worse, you might go to dialysis. So that's what really we have to prevent. Okay, so how to lower your blood pressure? You can do that by lowering your salt intake. So they according to Sprint study said that if you consume less than 2,300 milligrams of sodium per day from processed foods and table salt, so you can help to lower your blood pressure. Also, you need to adapt DASH diet. What is that DASH diet? DASH diet is it's diet is rich in fruit, vegetables, low-fat dairy, calcium, nuts, seeds, legumes, and adequate lean protein. Also, you can lower your blood pressure also by exercise and control your weight. If you control your weight, your blood pressure will be controlled as well. Okay, that's go hand to hand. If you drink alcohol, drink in moderation each day. So they advise, according to Sprint study, they advise that men can drink 2 drinks per day, and we men can only drink 1. And avoid smoking. High blood pressure with smoking doesn't go together, because that's really going to increase your risk to have stroke. If you have high blood pressure and you smoke at the same time, so your likelihood for you to have stroke is high. What is your blood pressure? You know, the numbers. So you can see in that poster, the normal range is less than 120, systolic and diastolic less than 80. So you have the category, you have normal, elevated with the numbers. Elevated is 120 to 129, and diastolic is less than 80. And we said high blood pressure stage 1, high blood pressure stage 2, and then hypertensive crisis is when your systolic is 180 or higher, and your diastolic is higher than 120. So hypertensive crisis, that's when you need to go to the ER and get checked and get evaluated so they can treat you. Keeping your systolic blood pressure below 120 will help you reduce your risk for heart attack, for stroke, and death. So this is a serious disease. So you really need to control your blood pressure. I hope that that teaching helped you a little bit and convince you how important it is once you have high blood pressure, how to control it, or if you don't have it, how to prevent it by exercise, by eating, right, adapt DASH diet and eat less salt. My next video will be on vitamins. I'm going to shoot a video on vitamins, my next one. And so just expect my video soon, because vitamin is really it's really a controversial topic. If in medical field, you're going to see some providers, they are for vitamins, some of them they are against it. But I think vitamins have its place, as long as you know what you're doing. So that's why information and teaching is very important to know. Therefore, you can guide yourself how to take your vitamins and everything. So again, make sure that if you have high blood pressure, you make sure you take your medication. Don't stop your medication without consulting your doctor. Your doctor needs to know, because also when you are on blood pressure medication, so, it's very difficult we control your blood pressure with one medication. Sometimes you need 2, 3, sometimes 4, sometimes I say 5 medication. It's so, sometimes you cannot control it, And also, that's why you need to consult your doctor, because if you stop your blood pressure medication and your blood pressure is, let's say your blood pressure was controlled and you said, you know what, I don't need it, I'm going to stop it without doctor's advice, because there's a way you can decrease it. You decrease it, there's a way, but you cannot stop it like cold turkey. That's not good, because you might, if you restart it, you might have resistance to those medications, and there's going to be very hard to control it afterwards. So please consult your doctor, because what we want to prevent stroke, we want to prevent blindness, we want to prevent congestive heart failure. So that's why we need to really take that in heart, to control your blood pressure and to monitor your blood pressure, and also keep a log, whatever blood pressure, whenever you take your blood pressure, write it down so you can have it if your provider asks you how much your blood pressure is. And also there's something called white coat syndrome. White coat syndrome, that somebody can be, at home, they take their blood pressure is fine. As long as they put their feet on the doctor's office or provider's office, their blood pressure goes up because of stress, because they don't like to see the doctor or the provider. So if you have the log and you can show your provider that, at home, my blood pressure is always controlled. And if we can see that, that's when they said, oh, you know what, that individual might have white coat syndrome. So on that, I'm going to stop. So I thank you for listening. Please do not forget to like, do not forget to share, because if we can help one people, that's what it counts. And subscribe. So when you subscribe, press all. So whenever video I'm going to add, they will notify you. On that, I wishing you the best health, and bye-bye.